I wanted to talk to you a minute about how trauma impacts the brain, particularly the prefrontal cortex. Prefrontal cortex is a wonderful part of our brain that governs executive functioning, helps us complete multiple step tasks, helps us focus on our work, helps us avoid distractions. And we think of ADHD as a dysfunctional prefrontal cortex. It's not firing like it should, and which is why we give stimulant medications oftentimes when kids have ADHD to help that prefrontal cortex fire like it should so we can have good executive functioning. Interestingly, when we have the impact of trauma or chronic toxic stress, there's an overlap in terms of what this looks like for both ADHD and trauma. And this overlap creates deficits in that prefrontal cortex firing. Because when I experience trauma, I'm always looking for threats. I'm always scared and I don't feel like I'm safe. Therefore, I'm always looking for the next, for that bear in the woods that's going to come attack me. And that prefrontal cortex is firing to do a good job with that. But again, it doesn't do a good job of avoiding distractions, of focusing on my work, just like a brain with ADHD. So it's important for pediatricians, for medical providers and mental health providers and parents and caregivers as well to understand that sometimes the same presentation, the same behavior might be ADHD, but it might also be fueled because of trauma. Keep this in mind when you're working with kids in our community so that we can help guide all our community's children to live their best lives. Thanks.